Easy. All right, guys. I'm Eric. I'm here from Chandler Physical Therapy. I'm joined with Dylan from Ahwatukee Weight Loss. He's been running a weight loss clinic now for 6 years out of Ahwatukee Family Medicine, off of, what is it, 46 and Ray?
46 Place and Railroad, yeah.
Right, all right. And we're here today because I have a lot of patients that come in and talk to me about wanting to lose weight. They're not quite sure how or the process to get started, why. And this guy is one of the best in the business to do it. So I wanted him to come in and kind of tell a little bit about what he does and how it kind of incorporates with us as physical therapists.
So Ahwatukee Weight Loss is a weight loss system that we created about 6 years ago. It's a system that we're training and educating about lifestyle versus just a diet. What I'm really trying to incorporate with the patient is the dietary component of just learning how to nutritionally plan and nutritionally prepare themselves for their longevity of life with their diet. One thing that Eric and I have always worked on and we always saw eye to eye on was the naturopathic perspective of what weight loss is and what the physiologic perspective is for a healthy body every single day for optimal everyday performance and just achieving the everyday lifestyle of healthy, clean eating for patients. And that's one thing that Ahwatukee Weight Loss has to offer is just keeping it as natural as we possibly can. Utilizing meal replacements that are an all-natural meal replacement will allow patients to kind of just have a little bit less of a responsibility at the very beginning so I can adapt a schedule and a regimen for this patient to allow them to have success down the road when it comes to a maintenance plan. So the system itself has been a system that's actually now been deemed by the American Society of Bariatric Physicians as the only prescribable treatment currently in obesity management. Meal replacement planning is now the premier type of meal system for patients to achieve better hemoglobin A1Cs with diabetes, better systolic and diastolic blood pressures, to achieve better LDL and total cholesterol functions. Great thing about medical weight loss is we're capable of managing all of these major obesity-related diagnoses and take them full-fledged in an aggressive type of manner to get these patients off these medications quickly.
And you're basically one-on-one with the patient the whole time.
One-on-one.
How often do they come in? Like, take me from the beginning till through kind of what you do.
Absolutely. So the consultation is typically a 30-minute consultation. It's a free consultation for patients. Once they decide they want to go and start the system, we go ahead and assess the program fee, which we have available on our website. But we go through the consultation. Body composition analysis is one of the major things that we do. It gives us the data that we're going to need in order to prescribe a meal plan and a treatment plan for these patients. Just like a doctor would see your cholesterol panel and say, okay, Eric, it looks like your total cholesterol is elevated. We're going to start you on this prescribable treatment. Same thing with me. I get my data, I see the data, and I go ahead and prescribe a meal plan for the patient in regards to the amount of protein, the amount of carbs, the amount of fiber, fats, and everything else that they're going to get, caloric indexes as well. During the consultation, I learn a lot of the behavioral counseling perspective of what the patient is and where they're at in their lifestyle.
Right.
So instead of altering what they're doing currently, I kind of just merge myself into what a lifestyle they currently have and learn their schedule, their work schedules, their off schedules, things of that nature. And we make our programs at a 7-day time frame. So 7 days, I see the patients weekly. So I'm only making this meal plan for the next 7 days of their treatment in order to see if this is something that they can adhere to. If there's questions and changes and adjustments that we need to be making, I can make them 7 days in-house with the patient during a 15-minute follow-up with myself. So very individualized.
Awesome.
The patient care
telling them, like, you're going to go eat chicken. You're giving them just say, hey, eat this amount of protein.
Correct.
And what you want. And
Correct.
That's what I liked about your plan.
Yes.
It's not like you have to eat X, Y, and Z, and that's all you get. It
Exactly.
gives you options.
It's not clear cut. It's just going to give them, similar to like a diabetic education, for instance, they use an exchange rate.
Right.
An exchange meaning a cup, an ounce, or a handful allows the patient to have the variety of their meal choices. So they still have to be essentially responsible for what they're doing, but I give them an exchange list that gives them a list of just what food items are going to be your best bet.
Right.
And here's the exchange plan that you get, here's your portion, and it allows them to kind of mix and match what they want to go and do so they can have the variety that they prefer as well.
Right. And you're kind of the proof in the pudding, right? Like,
Yeah.
this has worked for you. You've started a little bit heavier. Your supervising physician, Dr. Nichols, also started a little bit heavier, correct?
And what's great about that is, for the patient, one comfortability for the patient is the fact that Dr. Nichols and I have both been in the other chair, the patient chair before the provider chair.
Absolutely.
He lost 55 pounds in 3 months. I ended up losing 56 pounds in 9 weeks.
That's great.
Same system, same program that we currently use with our patients. Currently, we did it ourselves 6 years ago, and him and I have been successfully maintaining for the past 6 years. So every single day we work our program.
Absolutely.
We're in the patient chair every Friday with each other, touching base and making sure our meal plan's good, making sure our exercise regimen's good, making our body composition what we want it to be.
Outstanding.
Yeah.
That's great. So you use meal replacements. Tell me a little bit about that.
Yes.
As far as that incorporation into the plan, and how much is it, as far as how much are you taking a day, or how much those sort of things?
The meal replacement that we currently use is Cornerstone Wellness. Cornerstone Wellness is a business that's been established now for roughly 10 years. I've worked with them for the past 6 with my program.
Okay.
Cornerstone Wellness is the only meal replacement that's actually physician utilized. So what this means is it has to be prescribed to a patient. It's not just a supplement you can get over the counter, get on Amazon. It's something that you actually have to go to a physician's office and be prescribed. Okay. The component is 23 grams of protein, 10 grams worth of carbohydrates. So what we're trying to implement is a high protein, low carb type of meal structure. Okay. This meal replacement is all natural, gluten-free, lactose-free. It does have 200% of all the vitamins, the minerals, and the 20 non-essential essential amino acids. So instead of a patient going into a caloric deficit and also going into somewhat of a vitamin deficiency, we're replacing these vitamins every single day, sometimes twice a day, with some patients using 2 meal replacements within the day. So
how's it taste on those?
Taste honestly is great. Nice. To be honest with you, recently, about 3 years ago, Cornerstone Wellness ended up adding stevia as a sweetener to it. Okay. We use fructose, which is an all-natural monosaccharide for the patient, which is easily digestible and easily broken down in the body. But what I typically do with the patient is the powder is going to be mixed with an exchange of dairy, which will be a cup of milk of choice, and as well as an exchange of fruit, which is going to give them the option to go throw a handful of frozen strawberries in there or make a fruit smoothie however they prefer. So preference on taste with fruit, toss it in the shake, and you got yourself a shake that you enjoy.
Perfect. Tell me a little bit about kind of your biggest success stories. I know you got a lot of them. We've talked a lot, but there's some definitely standout.
Definitely standout success stories. We, we'll go male, female. My female patient, which you'll probably see on the website with the article "Mental Commitment," Melinda. Yeah. Melinda ended up losing 245 pounds in 76 weeks. No medications, no bariatric surgeries, just accountability and mental commitment, in my opinion. I've been asked multiple times, what is a success to my program? And I say mental commitment and accountability. You have the drive, the will, the ambition, the objective and goal to lose weight, and you put your mind on it, you're going to be successful. Accountability, coming in every 7 days, stepping on the scale in front of someone, it's powerful. It's extremely powerful.
That's what I like about the plan.
Yeah, and our male patient, Robert, started at 600 pounds. From my understanding, he was the heaviest patient in the Maricopa County. Wow. And we got an opportunity to work with him, and currently down to 350 pounds in just a little less than 2 years.
That's awesome.
No surgeries, no medications, just proper meal planning, adjustments at the right time, training, educating. Yeah. Really, I mean, a lot of these patients walk away with the comfortability knowing I'm going to be able to maintain this. I am going to be successful because I've learned a lot.
Good. Yeah. That's awesome. Now, when we see a ton of patients that come in through there, as far as they may need weight loss or they're interested in losing more weight, what sort of restrictions do you have, or are there restrictions?
No.
Come one, come all.
Come one, come all. As far as age restrictions, I recently just opened up the door to seeing young adolescents. I just recently treated a 13-year-old young man. Objective at that point was just to help maintain his body, to help him grow into it. Right. As far as age restrictions goes on the opposite spectrum, I've seen a patient at the age of 89, and she's successfully maintaining for 2.5 years now after losing 45 pounds. So walking 5Ks every other weekend, which is absolutely unbelievable from where she started. So age restriction-wise, none. Diagnosing restrictions, none. We manage anything from celiac disease to unmanageable diabetes, any obesity-related diseases, kidney function disorders. Being in the medical profession, I mean, we're very comfortable with managing multiple diagnoses, and we understand the parameters we must stay under to achieve proper health and balance for this patient.
And to kind of be clear, like your plan is something that takes commitment. You're not something that you're going to lose 50 pounds 1 week. Correct. It's little by little, and it takes time.
It's monitored weight loss. Yeah. It's consistent weight loss. Right. It's something that's not going to give you that HCG 20-pound loss, and all of a sudden you're stuck in the stone. Right. This is going to be something that is consistently going to be losing an average of 2 to 5 pounds per patient. When we see these patients back, if we have a maintaining week, we have a gained week, we have the adjustments to do so to make them get back on track. There's no such thing as a plateau in my program. We find a reason why something's not happening, whether it be a metabolic dysfunction per se, or something in their journal that we're just seeing that's just off kiltered, and they just kind of opened up their palate a little bit more and ate a little bit more that week. So always making adjustments and changes to a program allows that patient to feel that comfortability of it's not going to be the same thing every single week. And if I know I'm losing the right way, fat loss, which I'm able to check on the body composition testing, no muscle tissue loss, and some water loss, it's going to allow the patient to know that, all right, I'm happy with 2 pounds, knowing that this is fat.
Right. And you can gain maybe a little weight, so it's muscle and it works.
Exactly.
Works all right.
Exactly.
That's a beautiful thing. One thing I really do like about your plan is that there is that accountability piece.
Yes.
That's, you're coming in and you're stern when you need to be stern if someone's not doing their thing, but you're a coach, you're a friend.
Yeah.
You work their way through it. It's a journey for you. Like you said, you've been in that chair. So
yeah, I have. So one thing I've done is really learned how to build these relationships with patients.
Awesome.
Consultation starts as provider to patient.
Right.
Week 2, week 3 begins this friendship,
right.
this relationship on a sense of having that patient try to feel more comfortable with what obesity management is. It's a very uncomfortable situation for anybody.
It is.
I remember being in the position, it was very uncomfortable trying to talk to somebody about weight loss. And
not to anybody, but to yourself too.
Exactly,
Yeah,
to yourself.
To yourself.
And building that relationship and being a coach, being a cheerleader, being just a friend, and sometimes listening for 10 minutes to a patient who just had a tough week. I've been down that road. I've unfortunately had those tough weeks during my weight loss, and that's what's best for the patient is to know that the person across the table from me he understands.
Right.
He understands where I'm going to.
And you make yourself available to your patients.
24/7.
That's awesome.
24/7.
Yeah,
direct line, direct access to me. Doesn't go to an assistant. We could have 85,000 patients on this program, but I have 850 established currently because I know I can manage and treat all of those patients by myself. Because I want these patients to have the individual care.
Absolutely.
Yeah.
Well, that's great. Well, you also just stepped into a new office. You were just telling me right before we started here today.
Yes.
I'm going to have you tell everybody about that while I pull up your contact information, and then we'll wrap it up.
Perfect.
All right.
Thank you. Yeah. New system that's recently just opened up is going to be over in Chandler. It's Elliott and Ahwatukee through my doctor now. What's great about it is it's the same system. I'm the overseeing director of the program. And if you had questions about that program, you can just contact me at my direct line, which is flashing across the screen right now.
All right. Well, Dylan, I appreciate you taking the time. And if any of you out there have questions, don't hesitate to contact myself. Don't hesitate to contact Dylan. Everybody has struggles with weight at times. He's the guy to take care of it. So thank you for taking the time.
Appreciate the time, man.